So good afternoon. The title of the presentation today is Treatment of COVID-19 in Sri Lanka, the Healthcare Delivery Cost. Sri Lanka provides free healthcare at the point of service delivery, and the healthcare system is predominantly financed by tax revenue. Every given, even though given that the resources are scarce, while providing free of healthcare, Sri Lanka has been able to successfully control the spread of COVID-19. Treatment and disease control decisions made in any circumstances should also consider resource availability, scarcity, the opportunity cost of each decision, and the consequences and trade-offs that arise through such decisions. Thus, the objective was to assess the cost of treatment of a diagnosed COVID-19 patient admitted for treatment. We assessed the cost of treatment of a diagnosed COVID-19 patient admitted to a treatment center for treatment, and scenario-based costing technique was adopted. In estimating the costs for the 4 treatment categories, COVID-19 patients were categorized as asymptomatic, symptomatic with oxygen saturation more than 93%, symptomatic with oxygen saturation less than 93%, and critically ill. The data for the costs were obtained from the Medical Supplies Division, hospitals, and laboratories. Hospital bed cost per day was based on WHO choice model and adjusted for 2020. And ICU bed cost per day was based on personal communication. Average stay per patient was from literature. Microsoft Excel software was used for analysis. 2 calculations were done based on the initial guidelines and the revised guidelines by the Ministry of Health, and the results are given in table 1 and 2. As per the earlier guideline, total cost per patient per stay for categories 1 to 4 was approximately rupees 113,000, 125,000, 144,000, and 920,000 respectively. And repeated PCR testing for categories 1 to 4 was 17%, 21%, 18%, and 3% of the total cost respectively. Other investigations for category 1 to 4 was accountable for 1.1, 1.8, 8.5, and 17.2 of the total costs. As per the new guidelines, total cost per patient per stay for category 1 to 2 is approximately 100,000 and 106,000. And PCR was accounted for 6.5 and 6.1% of the total cost. The other costs of treatment remain the same. So to conclude, the treatment cost among COVID-19 patients depended on the severity of the illness. PCR testing and other investigations are responsible for considerable amount of the costs. As disease evolves, treatment and discharge guidelines may have to be revised considering the available resources and disease burden. Thank you.